Deirdre, thanks very much for joining us. Our topic is fighting back against a cancer diagnosis. And that fighting back frames the first question. Do we really fight against cancer, or is it just a matter of getting the right radiation or the right chemo or the right therapy pulled together?
There are many ways to fight cancer. Chemotherapy and radiation are the two strongest tools we have. We have other tools in our arsenal as well, which would be a strong attitude, prayer is a tool, exercise, healthy eating habits, adequate sleep, and listening to your body.
You mentioned in that list, you mentioned exercise. Why is exercise important with respect to fighting cancer?
Exercise actually helps improve patients' immune function, can improve their stamina, can improve their overall attitude, and their quality of life.
A lot of articles about this, a lot of stuff that you see and hear. Are there really cancer-fighting foods?
Well, antioxidants like vitamin E and C are considered to be fighting foods. They protect the body against development of cancer, and we think that they may also help prevent progression of cancer. Some people come to us and want to know if they should take high volumes of antioxidants, and the answer is no. They shouldn't, especially while they're on chemotherapy, because they can actually cause repair to the cancer cells that we're trying to destroy. So the best answer to the question is to try to eat a healthy amount of antioxidants in your daily food diet, but don't take any supplements.
Give me some examples of antioxidant-rich foods.
Things like oranges, fruits and vegetables that have a lot of color in them are very high in antioxidants.
Again, stuff that you read and stuff that you hear about holistic things and heat treatments and detoxification, herbal therapies, things of that nature. What about those?
Well, basically there's two types of holistic medicines. There's alternative medicines, and then there's complementary medicines. Complementary medicines can be used along with traditional treatments like chemotherapy and radiation. An example of complementary medicines would be massage, relaxation, aromatherapy. Massage is actually helpful for many cancer patients, especially those who have neuropathy from their chemotherapy.
Neuropathy being?
Being nerve damage from their chemotherapy. Happens a lot with some of the chemos we give in their fingers and toes, and that actually can help promote blood circulation and healing. It's not recommended for all cancer patients, especially those who might have skin breakdown. The massage could actually put them at risk for infection. So it's always best to talk to their doctor before starting any type of additional therapies. Alternative therapies are another type of holistic treatment forms that people come and ask us about. One example would be the IV vitamin C therapy. That would be considered an alternative therapy instead of chemotherapy, and it's the type of therapies we don't recommend at this time because there's not enough scientific basis for those treatments.
Let's talk about things that aren't medicine. Support groups, for example. How important are support groups in fighting cancer?
Support comes from many different areas, and it means different things for different patients. Support groups usually really do help people because they can surround themselves by people who have understanding of what's going on with their diagnosis, with their bodies, the feelings that they have that sometimes their family members don't understand. Support groups can help take that pressure off of them and to reduce their stress level, improve their quality of life. There's many different ways you can get involved in a support group. It can be led by a group of survivors, could be led by a nurse or a physician, could be based online with chat rooms. We are in the process of starting a support group here at the Cancer Center and Prevention Center, and we're also going to be starting a survivorship program, and then hopefully in the next year. So we hope that all of our patients will be a part of that.
In our first question, you mentioned prayer, which is a spiritual aspect. Spiritual wellness, the spirituality, what role does it play?
Spirituality comes in different forms for different people as well. It can really help decrease people's stress levels and anxiety. When patients come to us and find out that they have cancer, many of them become very fearful, worried about the future, worried about their families, and all of this anxiety can add to feelings of stress and worry and burden, and that burden decreases their quality of life. And by developing a spiritual wellness, either through prayer and faith, they can actually decrease their anxiety and improve their physical health as well. Spiritual health can occur, though, without physical health.
Positive mental attitude. We're taught all our lives that it's a good idea. What role does a positive mental attitude play with respect to fighting cancer?
Studies have actually shown that patients with a positive attitude who maintain a hopeful attitude do better while they're on chemotherapy treatments. They do better with side effects, and they do better, they recover faster from their treatments. That's not to say that a person can have a positive attitude all the time, and people sometimes get angry at themselves when they get discouraged or when they have a bad day or when they feel nauseated. But they shouldn't feel bad about that. The best thing to do is to try to keep a positive attitude and surround yourself with people that are encouraging to you and lift you up, and find support from your family and friends, and think good thoughts.
Related to that, based on your experience, describe the character traits of people who do well with a cancer diagnosis and in fighting the cancer.
Someone who is determined, someone who has perseverance, someone who has faith, someone who has, most of all, hope. Hope can come from many things. Hope for a cure, hope for more time with family, hope for comfort and peace. But I would say the most important thing for a cancer patient to have would be hope.
Very well. Deirdre, thank you very much for joining us.
Pleasure.